Senator Moran.
Chairman Capito, thank you very much. Doctor, welcome. Nice to see you again. Thank you for the conversations that we've had prior to this hearing. Doctor, this to perhaps follow on to what Senator Durbin was talking about. The life of a United States Senator, I assume, has lots of glamour and excitement, but I can tell you that perhaps the most satisfying, I say that with a smile because I'm not certain that it's true, but I can do say, in all seriousness, one of the places that I found satisfaction in this job, one of the reasons this job has value to me and hopefully to my constituents, is the work that we do in regard to combating diseases and finding the cures and the treatments for Alzheimer's and cancer and diabetes, and the list is ALS, the significant list, and the opportunity then to have a sense of satisfaction that our constituents are actually finding value from what we do. Of probably as all of the arenas in which I work as a United States Senator, this one provides the most satisfaction, and it's one that I can relate to my constituents in which they find satisfaction. There is a lot of skepticism and distrust about government generally, the federal government perhaps in particular, but where there does seem to be satisfaction with what we're doing is in support for finding those cures. And so what task you've taken on is hugely important to me, hugely important, I think, to this committee, and hugely important to the country. And how you make decisions now you have the opportunity to get the satisfaction of that I find at least in trying to do the things that make a difference in people's lives, individuals, and to provide that hope that Senator Durbin talked about. If Congress, you say this is a collaborative effort, and you're absolutely right, and I encourage Congress to exert its authorities and utilize its responsibilities in this arena and many others. So if Congress were to provide additional dollars above and beyond the President's budget request, how would we as a committee, and how would you as NIH recommend for us to prioritize that spending to get what you're looking for is in a bit shaking up the past process and system by which grants are awarded and results are attained?
Well, there's a number of ideas that I've had made in my Senate hearing when I was confirmed, as well as in other public things. I think first we have to focus on the real health needs of the American people, and they are enormous. Alzheimer's, yes, heart disease, diabetes, cancer, all of these we need to make, and so many others I don't have time to talk about, need focus and need research and need advances. I also have been heartened by the near bipartisan support that the NIH has long enjoyed, and I hope that we can get back to that. I view that as part of my job, is to say, look, let's have an agency that focuses on things that really matter to people, and as it has, and I think it continues to do. Second, we have to address some of the real problems in science, right? So the replication crisis I've mentioned many times, most people don't know about this, but a lot of scientific research, when independent teams look at the same result, they don't find the same answer. That's basic science. You'd expect there's reasons why that happens. There's no real advantage to doing replication work. That's something the NIH can fix. When drug developers do their own investments, they tell me that they do their own private replication work because they can't trust the biomedical literature. We can fix that as an NIH, and so I'd love to be able to fix that problem. We need to think big. Some of the advances are incremental. Let's focus on thinking big. So I think again, the budget, it's a collaborative effort, but I think it's going to be important that we address the real problems in science and the real needs of the American people with whatever budget that comes out, and that's my job.
Doctor, I think I wrote down what you responded, and among all those words, you said we need focus, research, and advances, and I assume that means need more resources, and that you would put them to good use. Is that accurate?
That's my job, is to make sure that every dollar goes to real science that really meets the health needs of the American people.
Let me ask one final question. Include Project is a trans-NIH research initiative established in 2017. The program is supporting scientists and universities and research institutes across the country, including the University of Kansas Medical Center, where researchers are studying Alzheimer's in people with Down syndrome. I've always been fascinated by this particular aspect of research that combines two things I care greatly about into one in some ways. As the administration advances efforts to unleash science across multiple NIH institutes and centers, I believe Include is a model for those objectives. Will you commit to working with me and the committee to ensure increased federal funding for this effort and maintain the status as an NIH-wide initiative?
I think that that's a tremendously important focus. I was recently at an event featuring the advances the NIH made in studying Down syndrome patients, and the early onset of Alzheimer's is one of the major problems that Down syndrome patients face. So I absolutely am committed to that, Senator.
Thank you, sir.